Okay, so we have a patient who is 42 years old and is taking insulin and ACE inhibitor. As a result, we see headache, anxiety, vertigo, sweating. These are reminding me hypoglycemia. When does hypoglycemia happens? When you take ACE inhibitors with insulin, you can have hypoglycemia. This is possible, but also it can be due to, let's say that you took your insulin in the wrong way. You missed the dose, you skipped the dose, you skipped breakfast, you took it with another drug, then it can cause hypoglycemia too, or if the dose is too much. And again, another thing can be if you take your enalapril wrong way again. This one is wrong, this one is wrong, both of them are wrong. This can also cause sweating, vertigo, anxiety, headache. So first, I would just check for the blood glucose level just to make sure if we really have hypoglycemia. Then I would show the right technique. I would educate the patient with the right techniques. If we're not sure about everything is right, I mean, before if they were doing it right or not, we would try the right way, and I would tell them to bring some sugar next to them just in case. Then we would check for something different. And by the way, if someone is coming to you for diabetes, you can check these levels. And we talked about hypoglycemia, so check about the blood glucose. Now we have 72-year-old, we have a 72-year-old patient. This patient is having insulin and metformin. Alright, and sees nausea, diarrhea, metal taste, swelling of the limbs. When I see all of these symptoms, these effects, all of them can be due to side effect of metformin. Yes, metformin causes problems like GI side effects, so diarrhea, nausea, and metal taste and limb swelling, but also insulin normally causes swelling too. But it's maybe not because of the metformin by itself, it's maybe because of the patient's mistake. Sometimes patients take metformin without food. This can also cause problems. You need to take your metformin at time, at the right dose, and with food. If my patient is not sure about how did they take it, I would show them the right way. And then if the things are still going bad, I would give them metformin XR. This is better. And by the way, for the diarrhea, we can give oral rehydration solution because our patient is 72 years old, so it's very risky to be dehydrated in that age. Now another case, 62-year-old, again old. We have insulin and diuretic. Okay, insulin plus diuretic. Excessive thirst, dry feeling in the mouth, rash. This shows me, actually, until here, it shows me hyperglycemia. So it could be wrong taken dose, or sometimes diuretics can increase the glucose levels too. It can be because of that too. Or it can be even diabetic ketoacidosis, because once you see hyperglycemia, just check for the diabetic ketoacidosis too. If it's more than 250. Check your ketone levels, check your blood glucose. And if it's caused by diuretics, like I told you, diuretics can also increase the glucose, then change your diuretic to enalapril. This is better. Enalapril is better. But what about the rash? Rashes can be very dangerous. Is it like a rash that itches, swells your lips, like that? Or sometimes there are some type of rashes which are starting at some point but then going everywhere. So we don't want that. We would check if it changes color, if it spreads everywhere. And what would I give to rash? For the rash, I would give hydrocortisone cream, or I would give something oral like hydrocortisone or cetirizine I would give. And now we have 30-year-old patient which is using insulin. This is okay, so this is long-acting insulin, this is short-acting insulin. And we have Dıabetes. This is for the neuropathy. Neuropathy means that numbness of legs and feet. During the diabetes we see it. And uses yasmin. Yasmin is oral contraceptive. Yasmin can increase glucose levels. Oral contraceptives can increase. Dıabetes, I think that can increase too. And we have insulin. Okay. What happens? Shaking, muscle pain, acetone breath. Okay, so the problem here is that shaking is hypoglycemia, but acetone breath is diabetic ketoacidosis, right? Diabetic ketoacidosis means your breath smells like acetone, your breath smells like fruits, you're vomiting, you have a stomach pain, and you cannot breathe well. We need to give you correction insulin. We need to give you some fluids. We need to check your ketone levels immediately because your blood is becoming acidic, low pH. It's very dangerous, life-threatening. So if I check my blood glucose, is it low or is it high? Which one? Because both of them is happening. So why did it happen? It could be happen like this. Let's say that this person forgot their insulin and skipped it, and then they can double it. They can do a mistake like that. I mean, this is a mistake. Then that's why at first there was hypoglycemia, then hyperglycemia. But what about the muscle pain? Insulins, like in the type 1 insulin, the insulin can cause muscle pain. I'm so sorry, it doesn't cause muscle pain. Muscle pain caused because of probably if there is hyperglycemia or hypoglycemia. When there's hyperglycemia or hypoglycemia, then we can see muscle pain. For example, in the hypertension, in the blood pressure, we were seeing headache when the pressure was changing. When the glucose is changing, we see muscle pain. So we checked the ketone levels, we got sure about the diabetic ketoacidosis, we checked the glucose levels, we checked about the hyperglycemia, hypoglycemia,